You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Daniel, how are you?
I'm doing well. How are you doing?
Great. Thanks for coming over.
Thanks for having me.
What is it to do what you're doing? Can you tell us a little bit about yourself and what was your journey?
Sure. Yeah. How early would you like me to start?
As early as you can have a good story.
Yeah. So I started out. I was pre-med. I was dead set on going to medical school. I studied biology and genetics, and I never thought I wanted to do research at all. I actually had to do an internship in order to graduate from my undergrad, a research internship, and I put it off to the very last semester because I really didn't want to do it. And I took the offer that was maybe sounded the most not the most interesting, but they offered to pay me $11 an hour, and that was enough to say, well, okay, if I have to do it, at least I'll make a little bit of money. And so I did. Started doing data entry at the EPA in the National Center for Computational Toxicology, and I had a fantastic mentor there, Dr. David Dix, and he gave me a side project to work on, which is interesting little gene expression study. And that's what I think started. I got bitten by the bug. Once I had a problem that was up to me to figure out, I was like, oh, this is kind of fun. And they gave me another one and another one. And then I said, well, maybe I'll take a year off after undergrad. I'll keep working there. I started learning about machine learning and how to write code, something that's very different from anything I'd ever done. And we were working on looking at environmental chemicals and how we could predict which ones were going to cause certain adverse effects in humans. And I thought that was really interesting. And so they offered to support me through graduate school. I started off with a master's, and I said, well, I'll do this and then I'll go to medical school. And so I joined the master's program at UNC Chapel Hill, and I continued doing research at the EPA. And I just really started enjoying it. And I love the challenge of trying to figure out a problem that someone else hadn't figured out yet. After that, I decided I'd go on for a PhD, and I finished that, and I decided maybe research is the track for me, but I wanted to get closer to the clinical medicine stuff that I first sort of fell in love with. And so I did my postdoctoral training at North Carolina State University in the Bioinformatics Research Center in the Department of Statistics, and really focusing on pharmacogenomics and precision medicine. So trying to figure out, if two people have the same disease, why one person responds to this medication and another person doesn't. And I got to work in lots of different clinical areas, which I thought was really, really cool. I did some work in diabetes and some work in Alzheimer's. And I decided that's, what I wanted to build my program to look like. And so when I left to start my own program, I came to the Cleveland Clinic, which is where I am now, because like lots of big academic medical institutes that have big research programs, the Cleveland Clinic has expertise across so many different clinical areas that I can partner and collaborate with, clinicians that are, they truly understand their patient population. They know the problems on the ground, and then I can work with them to come up with, data-driven solutions to try to, identify which patients are at risk of a disease, which ones are likely to respond to an intervention. And we have projects ranging from everything from epilepsy and obesity and chronic pain, diabetes, just lots of spanning the whole clinical area, which is, it's a pretty cool opportunity to get to work in so many different areas and with so many talented other researchers and clinicians. And it's definitely keeps me entertained, that's for sure.
Yeah, this is a great field to be in, and I think most people, when they talk about medicine, they mean clinical medicine. But what you guys are doing is basically keeping the front behind the scenes there for the clinical medicine to improve the way it does. And I don't think people appreciate your work the way they should. Because what I'm looking at in clinical medicine is basically a decision-based factor based on the studies and the research that you guys are coming up with. And I think a lot of things can change in healthcare just because of the work that you're doing.
That's the goal.
What is it to be successful in your field?
Yeah, so I think that's, people I think define success in different ways. Career success, I think, is in my field is a lot of times it's measured by the number of papers you have that you get published, or the number of citations those papers have, or the amount of extramural funding that you bring in to support your research, and which all those things are important, and they're metrics for productivity and things. I also think you also have to have healthy, balance in life, right? We make sure that you, I don't feel like life it's a marathon, not a sprint, right? So you have to figure out how to ways to balance out some of the intense workload. You're in the area I am, you're always trying to solve a problem that no one's solved before, right? So it's there's lots of failure and rejection, ideas that don't work, and you have to kind of learn to persevere through those things. And I think in order to do that, you have to also have a great support system of family and everything else too. So for me, it's being able to accomplish my goals in my career while also making sure that I have the time and to spend with my family, and have that aspect of it as well in order to be truly successful. I think that's my measure, at least.
Interesting. We relate to the success part mainly because we overcome failures and setbacks. Do you have any examples of this in your career, in your life?
We're overcoming failures. Oh yes, yes. So uh, there's lots of proposals and papers and things that are difficult to, either it doesn't work at first or it's difficult to get acceptance around it. One example that we had that I think is interesting and actually was born out of another failure. So there was a clinical trial that was done in the late 2000s. It was called the Accord clinical trial, and the idea was they tested patients to see if they intensively treated their glycemia, which means, so right now, if you have diabetes and you have cardiovascular disease or you're at risk of cardiovascular disease, the blood sugar levels that your endocrinologist will target are not as low as someone who doesn't have diabetes. And the idea was, if we try to push blood sugar levels lower, closer to someone who doesn't have diabetes, will we have better outcomes? And actually, when they did this, they had an increase in mortality, and they had to shut the trial down early. And at the time, I believe it was the most expensive failed clinical trial in history. It was big news. And since then, the mantra has been to de-intensify. When patients are older, when the duration of their diabetes gets longer, they don't pursue those aggressive targets. And lots of people have tried to understand what it is about these patients. Like, why did that increase, mortality? Where was the risk in that? And so we looked at the data ourselves, and really we saw some interesting things that we really couldn't figure out why, what it was about some of these patients. How can we identify the patients that were at risk for this, and what was driving that? And we ended up, after trying a lot of things that didn't work, we used a method that had not been used in this clinical context before. It was really only used in like video signaling data, audio signal data. It's called dynamic time warping, which is, I think, maybe the coolest name of any method that I know of. But what we were able to do is we actually found a subgroup of those patients that actually benefited from this treatment. And they had greater than a 50% reduction in stroke, heart attacks, and we were able to develop a model to predict those patients. And because of this, and this has been the mantra, there was a lot of pushback about this, whether or not this is real, whether or not it's okay to do. But the evidence was pretty strong. We knew we had analyzed it in a really rigorous way. We knew that it looks like these patients probably would benefit and have a significant reduction in their risk if they were treated this way. And so we ended up doing additional studies to validate it. We found large cohorts that we were validating. We're doing another validation now, and we've recently partnered with another company that is now the acceptance level is to the point where it's going to be implemented into clinical decision support systems, so that patients will be able to take a simple test. It could be a buccal swab to have their DNA sequenced. We'll be able to identify which patients are the subtype of diabetes that would benefit from this. And so I think it's an example of, the story's not done yet because we're still working on it, but it's an example where, a trial that was based on an idea that made a lot of sense at the time, it failed and created sort of a mantra after that of how a narrative for how these patients should be treated, that when you look at it a different way, actually was probably preventing some other patients from benefiting. We looked and looked and looked and finally found an approach that was able to sort of peel back the curtain a bit, figure out what was going on, and now we have a new test that patients will have access to and hopefully benefit from.
That's so cool. A failure that became a success.
Yeah.
That's a great example. Now, going back to yourself a little bit, what do you think there's some traits that you personally have in your life that kind of they fit this kind of lifestyle you have and in the profession that you have? What does somebody need to have in medical school or in their life to be a good I would say epidemiologist, or work in statistics, or do clinical studies, anything that's related to the research part of medicine?
I think one of the things that has been a little bit different about me, better or worse, a lot of times in research, people, they really focus on one very specific area. They become an expert in that one specific thing, which I think is a great thing for people to do. For me, I've sort of expanded my toolbox, I would say, across by working in a lot of different areas. And then I work very closely with those people that are the experts in their specific domain, and then try to come up with new ways to look at things. And I gave one example there with the diabetes study, but we try to pull from analyses. Let's say they're used in stock market analysis, and try to apply it to clinical data. Try to do things that are a little outside the box, because a lot of fields, I think, when they're somewhat siloed, the same methods and things get used over and over again. And if you really want to break that open and find something new, you've got to do something that's different, right? So you have to pull, and there's lots of great ideas that have been used in other fields. And so I think one of the things I try to do is come up with sort of creative solutions. Sometimes they don't work, but every now and then, you'll find something really interesting. I think I'm also stubborn, so I I tend to like not want to let something go until I really feel like I've seen it through. So I think all of those things have kind of helped contribute to this. And I like collaborating with people. So it's fun for me to work on these projects with my friends and colleagues. It makes doing research fun, and so I think all of those things help, I think.
How is a day in your life? Tell me, in your career, what do you actually look at a day to look like?
Yeah, so my days are full of a lot of collaborative meetings and work, and I have a team. I wear a few different hats. So I have two startup companies that I'm heavily involved in, that are all both in the precision medicine space. One's in cancer, and the other one is in pharmacogenomics, precision medications for across a lot of different disease areas. And so I'm involved with
Are those your private enterprises?
Yes, yeah, yeah, and then those are a lot of fun. I've realized that uh, I love publishing papers and moving the field, but I've also realized that if you really want to change the way things are done, I feel like commercialization is a great way to do that. And so that's kind of been the next step for me, is identifying opportunities to sort of help close the gap at the end, on the implementation side too. So, and then I have my role at the Cleveland Clinic. I just started a new role here where I'm now the chair for the Department of Quantitative Health Sciences, where we have about 120 researchers in the department, all doing collaborative uh, research across the entire Cleveland Clinic to help support all the clinical research that goes on here. And so, I have a team that I work very closely with that I make sure that I'm aligned with every day. We have many people on my direct team. They have their own projects that they are working on. And so, a lot of times we're identifying collaborators and partners to help us move those things forward. And like I said, those projects span, we have everything from ocular disease projects to epilepsy. So it really spans, the gamut. We have osteoarthritis projects, lots of different clinical areas. And so it's really interesting because I just learned so much about, every time I'm working on these projects, I end up learning all about the pathology and the struggles that the physicians have in identifying the appropriate treatments, or the struggles that the patients have dealing with this. And so it's a pretty rewarding day usually.
Interesting. So tell me a little bit more about your private enterprises, because this is a thing that it's interesting to me to combine, where you combine your public research, um, you know, time with actually a private enterprise and a
Sure.
startup.
Yeah, yeah. So I'm involved with two primarily. One of them is called Clarified Precision Medicine, where I'm the chief technology officer. And Clarified's addressing a really interesting problem. So right now, if a patient has cancer, um, one of the options to identify the best therapies for them is to get their tumor sequenced and identify, what mutations are in that tumor that can be matched to a therapy that would target their specific cancer. The challenge is that there's a big gap between the number of patients that are eligible to get that sequencing done and the ones that actually do. Roughly maybe 17% on average, or that are eligible to get the sequencing. And one of the major gaps of that is that the reports that come back are very dense. They're long, they're difficult for busy oncologists to interpret. Sometimes they're 50 pages, let's say. And a lot of times they have multiple matches, maybe 5 different therapies a patient would be eligible for. And these labs are prohibited from a regulatory standpoint about giving medical advice. They can just tell you all the options. And an oncologist, especially one that's in a busy community center, community health practice that is seeing all comers, it's very difficult to stay up in the latest literature about every medication and every different cancer type. And so what we did is we developed a solution where we ingest the results of the lab. We use machine learning. We pair the mutations with the therapies, and we rank them based on our knowledge base. But we're also a medical practice. So we present that to an expert in precision medicine, either a medical oncologist or a PharmD, and we present it in a way that's very quick and easy for them to identify if they're appropriately ranked. And then what we do is we give a one-page report. It's very, very concise, and it just ranks, step 1, 2, and 3, what medications are most likely to work for that patient. And so the physician, the oncologist, can just look at it, right, as they're going to the treatment room, immediately identify what the most appropriate therapy is for that patient. If you're at a large academic medical institute, a lot of times they'll have a molecular tumor board that will do something similar, but they usually, because of the throughput, maybe get through 4, 6 patients a month. We can get through, we've pressure tested this over 1,000 patients a week. So we can really scale and make sure that, all patients, whether in a community setting or a large academic practice, can get a molecular interpretation of their cancer to figure out what the best therapies are for them. So
Wow.
that's been a really just an amazing journey, working with this team that's part of that, and we actually can see the difference. We identified recently when we did a test that a little study, and we showed that a third of the time that the oncologist received our report, they changed their mind about what therapy they were going to give the patient. It influenced.
Yeah, it's, the more we found out about this kind of therapies and the modalities of like personalized medicine, especially in cancer treatment, I feel like we get more and more accurate with what we're doing. Because I remember back in the days, when somebody was diagnosed with cancer, any type of cancer, there were basically a couple of protocols only that you can apply to that specific cancer. There was not even a question about, oh, let me see what this particular patient can tolerate, or, what is the advantage of using this medicine in this patient or not. It was just a kind of, cookie cutter type
Yeah.
of treatment in cancer. And now I feel like you guys are coming up with so much detailed information about what is the DNA of that specific patient tumor, particular to that kind of treatment medicine. And it's making a big progress. And I don't think the clinical world understands what kind of research efforts are involved here, at your level, to come up with this type of decisions.
Yeah. It's a massive it is a massive effort to move the needle on these things. It's not only on the discovery side, right? There's identifying these targets, understanding what's driving them, and then developing these therapies. That's obviously a massive investment and effort. But then also it's that final mile gap, right? How do you close that implementation gap so that the physician, when they're treating them, can get easily get access to the information, understand what decision to make about it, and make sure the patient receives it.
Are those things published? Do they need to be like actually published for the physicians to get to know them?
I
Those
think
conclusions.
I think a lot of time, some of those things are being published. We're publishing things. But the volume that is that's coming at these physicians is so high,
Yeah.
right? The innovation's happening so fast, which is great. But it's very difficult, for any one person to keep up with all of those things. And that's where we can come in with experts that are, true experts in this very specific task that can help support them. And so,
Yeah.
it's an exciting opportunity, I think.
I feel like every specialty should have, let's say in a hospital, like every specialty department should have an assigned research physician from your department to kind of be a consulting, expert opinion of what's coming out new with that specific tumor, because like you said, it's hard for the clinicians to keep up with these things every day, especially in this technologically advanced era that we're in, where most of the information right now, it's like either you ask Siri or Chat GPT,
Yeah.
or you go on Google, Dr. Google, and find out. How do you keep up with everything that's coming out every day?
Yeah. I think it's impossible, I think, for any one person to be able to keep up with all the things that they have to at all the times. And I think that's a big opportunity for AI, is to really help condense that information, make it so that it's reliable, but it's got to be trustworthy. I think there's a lot of opportunity for AI in healthcare. It's already changing the landscape in many ways.
How do you implement AI in your field?
Well, there's a lot of ways AI is being used. So there's both on the discovery side, developing models. We do a lot of work, my group in particular, developing predictive models for disease risk or drug response. And we leverage everything from genomics to other types of molecular data like epigenetics or metabolites, or a lot of times we use electronic health record data. It's a, all the data is collected on the ICD codes and CPT codes, lab values. That data is really valuable. It's also very messy and can sometimes be unreliable. It takes a lot of kind of curation and work to leverage it appropriately, but it's a great resource to help aid in clinical decision support. So we do a lot of work leveraging machine learning and AI in that space. And I think there's a lot of new developments with AI streamlining, other tasks that are otherwise, very labor intensive, whether it's, AI scribes or other things that I think
Mm.
ultimately will help hopefully ease some of the burden on clinical practice, help with efficiency, and also just maybe prevent burnout and other things that will allow clinicians to spend more time sort of engaging, understanding their patients and working with them, as opposed to their time being filled with some of these other tasks that can be now
Yeah.
offloaded. But I think sometimes this move fat was it the move fast and break things mentality of like Silicon Valley mentality of innovation, which is great in some space. I think, in healthcare, we have to be really careful because we have to do this in a way where we're really good stewards. We do this with a lot of rigor and, carefully, because if, obviously the risks are high in healthcare if you get it wrong, and you don't want to lose trust, right? And so we have to make sure that we're implementing AI around clinical decisions in a way that's really responsible.
Yeah. I want to kind of switch gears a little bit, and want to ask you, part of your success is not only professional, but in medicine, people think that we make a lot of money and we spend a lot of money and we don't keep a lot of money. So I'm trying to ask people, like, from your point of view in the situation and profession that you're in right now, what do you think your plan is for when you go with your career, or you don't want to practice anymore, or you just want to retire? Uh, what would be the financial solution to that?
Well, I think I primarily am focused on, I think if I'm doing things that are interesting, hopefully impactful, you know, live my life, responsibly. Uh, I don't know, retirement for me is like kind of a funny concept. I think one, I'm still relatively young and early in my career, I think, um, but I think I'll probably always have you know, some basis in research. I don't, or doing some sort of research. In some capacity. I don't know that I can see myself fully walking away from it because
Hmm.
I would like to maybe scale it back, have more time for family and those types of things. But for me, I think I'll always have some part of me that's looking to have some interesting project where I can contribute to something. And I think it's just part of my core, I think.
Yeah, yeah, absolutely. Um, yeah, I think retirement as a concept is changing
Mhm.
nowadays, and I think people work more, longer, and uh, they don't necessarily consider themselves retired from one job or another, but they keep doing something
Yes.
after they pass to a different level, or they want to do something that they never done.
Hopefully I'll be able to pick and choose all the fun parts that I want to do and really put my energy into those things and maybe let
Yeah,
some other stuff go.
yeah, exactly. So now, you said you're relatively young in your career and you have a lot going on right now with different hats that you're having. But with your experience and the kind of the wisdom that you got so far, if you would look back to yourself when you started in undergrad, what kind of advice would you give to yourself?
You know, I think I would tell myself that it's okay to say no to some things. I think I worry about missing out on opportunities, and I'm easily excited. There's lots of exciting things going on. Uh, it was very easy for me to overextend myself by, just there's so many cool things going on. I wanted to be a part of, all those things. Um, but I think in hindsight, I probably could have been a little bit more selective, might have been a little easier on myself, and maybe focused a little bit more on some of the core things instead of worrying so much about having to, you know, force the time needed to do all the different things I had sort of committed to. Um, I think it's easy to do that, especially when you're starting out, because you don't know what's going to pay off, right? You don't know what's going to be the big thing that leads you to the next step that you want. But there are probably times where uh, I could have probably let some things go and really focus more on probably the higher yield things, I guess.
Yeah. Well, obviously, when you're that young, it's the fear of missing out,
Right.
um, an opportunity. So yeah, I totally understand that. We don't say no enough in life in general. Like I don't think it's just you. I think it's people that have the notion of like doing a lot of things
Mhm.
for different reasons. And it's okay to experiment, but I think there are a lot of things that if we could just learn how to say no more frequently, it would
I
be
think
better.
so. And I've had a little. I still need to work on saying no more probably, but I had a little bit more practice now. And I will say, I was always so worried about saying no that I was going to let the other person down, or they weren't going to understand. And people always seem to understand when they'd much rather you be honest with them and say, I just don't have the time for this right now. And maybe you help them find someone that can help them. But with a little bit of practice, getting saying no got a little easier. Once I realized that, they still want to be friends with you afterwards, right? If you're not
Yeah,
able to help them right now, and so I think
yeah.
it's, it-
So Daniel, how can people learn more about your work, what you're working on, your projects, and what's coming up next for you?
yeah, I think well, I've got this new role now leading amazing department at the Cleveland Clinic. We're it's called the Department of Quantitative Health Sciences, if anyone wants to Google it. We're doing some really great things. We're expanding the department. We're going to do a lot of stuff to help scale, not just the clinical research that's going on right here in Cleveland, where I am, but actually across the globe. The Cleveland Clinic is a global enterprise, so we're going to be helping to support all the clinical research going on, everything from Cleveland Clinic London and Abu Dhabi and uh, Florida. We have a lot of uh, amazing research going on, and so I'm super excited to help grow this department and help use data science to really drive innovation across clinical research. I think there's just so much opportunity. The technology is changing so fast; it's opening up all kinds of new avenues, and so it's just a really exciting time to be in doing data science and statistics and clinical research. So
Yeah, that's awesome. That's awesome, and I congratulate you for this new hat that you have right now. You're very young, and I hope you're gonna do great things in that department. It's a great environment to be in. I mean, Cleveland Clinic, it's one of the world leading places to do this.
it's a wonderful place to be.
Exactly. Well, thank you so much for being here, and I hope people will look into your research.
Thank you so much.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.